Hello, it's good to have you here in this environment. I'm Dr. Miriam Smith, the host for Empowering New Nurses. I'm happy you're here this evening to share with me in this episode, which definitely will be in some of the encounters that patients experience in the healthcare system as they move from one area to the other. Now let's think about this. As a patient comes in the hospital setting or the healthcare or the fast healthcare facility, they meet different individuals that keep asking them questions and questions upon questions. Now, if that individual speak nicely or interact positively with that patient experience can be different. Although the patient might be ill, that patient self-esteem, that patient's sense of belonging can thrive on giving information that maybe would have been hidden had it not been that sort of encounter. And so I want to take you to an experience whereby if one should know that this matters, yes, every encounter matters. Each person, the one who asks the question, the one who puts the patient to the bed, the one who assists the patient to get a urinal or a bedpan, whatever it is, the one who takes the x-rays, the one who gives the injection, whatever area of the interdisciplinary team or the interprofessional team that you may fall or one might fall, just remember that that encounter should be individualized and taken seriously because there is a human being who deserves the best care. And so sometimes the patients are anxious. What do we do? How do we help to relieve? How do we communicate with them to alleviate some of the anxiety, the stress, and the fear? It behoves us then, as healthcare providers, as workers within the healthcare system, to be empathetic. What do I mean by that? Throwing yourself in the patient sphere, experiences, as it were, what the patient is going through, a sense of understanding. That's so important. So as we think of empathy, when we think of empathy or how the public or the population around us would look at the individuals who serve, like the doctors, the social worker, the nurses, and different caregivers, the PCA, the assistants, the healthcare assistants, they have a different mindset. They have a different thought process. What are the characteristics of those who care for their loved ones who are at the most vulnerable state? They are thinking of someone who is compassionate, one who listens, one who is caring, one who would go the extra mile to help a human being, and so forth. So, encounters are critical for the patient, and it should also be for the caregiver or healthcare providers. From my personal experience, I know I've served in different areas of nursing, and so I know. So my young nurse, I would encourage you, my suggestion to you is that your encounter with your patient should be one that stands out because you're caring for a human being at his or her most vulnerable state. Show compassion, show that you care, and not just the patient, but the family members, They are at a high level of anxiety and fear, fear of the unknown, fear of maybe an amputation, fear of diagnosis. Is it cancerous? Or will I live? Those are some of the things that the patient would express. Or they might just withdraw themselves because they think they're on the last. Some of them might be, others might not. So talk with your patient, listen to your patient. I'll repeat, listen to your patient and their family. And that will make you have a different outlook, a different way of making that care plan for that individualized patient. And in addition to that, remember culturally congruent care. Culturally congruent care, we embrace that. That patient needs that customized care, that individualized care at all times. Thank you for listening. How can you connect with me? On YouTube, Miriam Amanda Smith. Yes. On Instagram, it's Podcast Mir. And on the Empowering New Nurses, that is on my podcast. Thanks for listening. Now, I'd like you to subscribe. I would like you also to share and comment. If you have not yet gotten your copy of this book, Nurse, The Guide to Empower New Nurses in the Delivery of High Quality Care to All Patients, tidbits are in there that can help you as you embrace, as you make adjustment, as you adapt to this nursing on your nursing journey that can help you along the way. It helped me and it helped others. And if you read the testimonials of others, you will see and you will read for yourself the impact that it has on many young nurses. Thank you so much for listening.